Hello! Today we're gonna talk about the renal system drugs, crystalloids, specifically the hypertonic fluids. The generic name is crystalloids hypertonic IV fluid, and the brand name are 3% sodium chloride, 5% sodium chloride, dextrose 10% in water, dextrose 20% in water, dextrose 50% in water. Drug classifications. Therapeutically, hypertonic IV fluids are classified as volume expanders, total nutrition component, and fluid volume replacement. Pharmacologically, hypertonic IV fluids are classified as carbohydrate. Pregnancy category is C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risk. Mechanism of action. Dextrose is a rapidly metabolized source of calories and fluids in patients with inadequate oral intake. While increasing blood glucose levels, dextrose may decrease body protein and nitrogen losses, promote glycogen deposition, and decrease or prevent ketosis if sufficient doses are given. Dextrose also may induce diuresis. Parenterally injected doses of dextrose undergo oxidation to carbon dioxide and water. A 5% solution is isotonic and is administered peripherally. Concentrated dextrose infusions provide increased caloric intake with less fluid volume. They may be irritating if given by peripheral infusion. Solutions above 10% should be given only by central venous catheter. Pharmacokinetics. Administered intravenously, the onset and peak are immediate. The hypertonic IV fluids are metabolized to carbon dioxide and water. So the half-life of the hypertonic IV fluids range from 20 to 40 minutes to conscious patients and 80 minutes or longer to patients with preoperative stress, dehydration, blood loss, or pregnancy. Dextrose solutions expand plasma volume. Dextrose solutions may produce diuresis. Hypertonic IV fluids are indicated as a fluid replacement and calorie supplementation. Hypertonic IV fluids are contraindicated in patients in diabetic coma, while blood glucose level is high, patients with intracranial or intraspinal hemorrhage, dehydrated patients with alcohol withdrawal syndrome, patients with severe dehydration, anuria, hepatic coma, glucose-galactose malabsorption syndrome. Hypertonic IV fluids are used cautiously in patients with cardiac or pulmonary disease, hypertension, renal insufficiency, urinary obstruction, and hypovolemia. The side and adverse effects in the central nervous system are confusion and consciousness in hyperosmolar hyperglycemic non-ketotic syndrome and fever. For the genitourinary or osmotic diuresis and glycosuria. In cardiovascular system or pulmonary edema, exacerbated hypertension, heart failure in susceptible patients, phlebitis, venous sclerosis, and tissue necrosis. In metabolism or hyperglycemia, hypovolemia, dehydration, hyperosmolarity, and hypoglycemia from rebound hyperinsulinemia. In the skin are sloughing and tissue necrosis. For others are vitamin B complex deficiency. Before administering the drug, assess patient's health history. Patients with kidney or heart disease and those who are dehydrated should not receive hypertonic IV fluids. These solutions can affect renal filtration mechanisms and can easily cause hypervolemia to patients with renal or heart problems. Before infusion, assess the patient's vital signs, edema status, lung sounds, and heart sounds. Continue monitoring during and after the infusion. verify the order, state the specific hypertonic fluid to be infused, the total volume to be infused, the infusion rate, and the length of time to continue the infusion. Monitor electrolytes and assess for hypervolemia, may cause fluid volume overload and pulmonary edema. Avoid in patients with cardiac or renal conditions who are dehydrated and in patients with diabetic ketoacidosis. During infusion, monitor and observe the patient during administration. Infuse concentrated solutions slowly. Rapid infusion can cause hyperglycemia and fluid shifts. Administer only in high acuity areas. For short-term use to correct critical electrolyte abnormalities. Do not administer peripherally. Hypertonic solutions can cause irritation and damage to the blood vessel and should be administered through a central vascular access device inserted into a central vein. After infusion, monitor for serious adverse effects. Watch for signs of hypervolemia. Prevent fluid overload. Ensure that administration of hypertonic fluids does not precipitate fluid volume excess or overload. Monitor blood glucose closely. Rapid infusion of hypertonic dextrose solutions can cause hyperglycemia. Use with caution for patients with diabetes mellitus. Monitor patients' compliance to the drug therapy. Thank you for watching and listening.